Wow, we really getting excited about this program, and by the volume of your correspondence, questions, and we sincerely hope that one of these days we're going to actually dedicate an edition to answer publicly to many of the questions that have been raised. But for today's program, I want to sincerely welcome you. I remain your host, Adepoju Feyi, on Eyesight. Again this week, we're going to talk about another very common ocular disorders. Although it's common, it tends to come in at a time and then you don't hear of it again. And after a period of time, you hear it again as if it's a visitor coming to visit and then to return. I'm talking about no other disorder but Apollo. Apollo is not the medical name, and we're going to tell you what exactly is the medical name and where the word Apollo came from. And then to do that, it's going to be another guest who we have interviewed on these also common ocular disorder.
I am Dr. Onobolu, and I'm from Olabisi Onabanjo University in Shagamu. I'm here to give you a brief talk on viral conjunctivitis. Now, viruses are very small living organisms that cannot live on their own, but they live on other living cells. These viruses can infect the eye. And what is interesting about it is that it's very rare to have a virus infect only one eye. Virus infections of the eye, they are usually very contagious, especially the one we know as epidemic keratoconjunctivitis. These viruses can spread very easily, especially in school children, in households, and in villages. As I said before, I said they are very, very contagious. So I just want to say that it is very rare to have one eye being infected with viral keratoconjunctivitis. So if you have only one eye that is red, that is certainly not epidemic keratoconjunctivitis. Can affect children, and adults of any age. But usually you need someone in the house or in a school or in the environment that would have had the disease before. So people usually present with watering of the eye and feeling as if there are stones inside the eye. We call this foreign body sensation in the eye. Within 24 hours, the eye will become red. The lids will become swollen, which we now say that the lids are puffy. Very soon, within another 24 hours, the other eye gets affected. So we have the two eyes being red, watery, and with this feeling of, foreign body sensation, as we say. Sometimes there's a discharge, but there's usually a purulent discharge only when the eye is infected by bacteria. It's very, very important when you have the two eyes being red, watery, and with this foreign body sensation, to be careful of what you use to clean your eyes. Because if you are not careful, then you will infect other members of your household or your friends, which simply means that if you use a hanky, then be careful that you don't throw that hanky away anyhow. Or if you use a towel, make sure that your children or your mates do not use that same towel. Viral keratoconjunctivitis is usually known as Apollo, 1956 to be exact. And an astronaut went to the moon at that time, and it was soon after he returned that people started developing red eyes. And that people thought that, well, it must be that astronaut that brought the virus or that brought the disease from the skies. So that's why we call it Apollo. Viral keratoconjunctivitis, otherwise known as Apollo, has a limited time. So it is not something that should worry us at all. But because the symptoms can sometimes be very bad, in short, you will feel as if your eyes are popping out. You know, the redness can be very, very severe, and the watering is another problem that people may have to deal with. So you think, this is a very serious disease, but I can tell you it is not. The first thing you should do is to wash your eyes with clean, cold water. And I want to repeat, clean, cold water is what you wash your eyes with. Then you may need antibiotic eye drops, and I am going to mention only 2. That does not mean that we have only 2. It's chloramphenicol eye drops that is very, very popular, and you can buy it anywhere. You can also use chloramphenicol eye ointment. Be sure that there is nothing else added. Be sure there is nothing else added. You do not want to use mixed drops of chloramphenicol and steroids, just chloramphenicol eye drops. But then you have to instill it into your 2 eyes as often as possible. If you go and buy drugs that have steroids in them, then you will encourage bacteria to grow in your eyes. So ordinary chloramphenicol eye drops, but instill them as often as you can, at least about 8 times a day. You can also use gentamicin eye drops. The problem with our people is that because sometimes you feel so bad, you know, as I said, as if your eyes will pop off. So you may now, some people will tell you, use urine water. Never use your urine, you know, in your eyes. If you use urine, then the diseases in your urine, you know, the bacteria that's usually teeming in your urine will then infect your eyes, and then it will become very purulent. What is even more, you may now develop more severe infections. Very many people have developed gonorrhea of the eyes because they had gonorrhea before and they were washing their faces with urine water. Do not use plant juices. Some people will just go to the farm and tell us that our grandfathers and so they have used plant juices in their eyes and they are okay. Those plant juices may actually contain other more serious germs which can now kill your eyes. Do not put camphor. Neither should you grind kaffir and then put it into your eyes. That is very, very bad. And don't use onions as well. Some people may even say that, well, don't use urine, but put sugar water. Please don't use sugar water inside your eyes. Some will say, no, it is not sugar, but put salt water into your eyes. Don't use salt water in your eyes. Unfortunately, some people will even tell you that if you use battery water, you'll be okay. I mean, that is dangerous. Don't use battery water. Some will now say that, well, you can put onions in your eyes or even pepper into your eyes. Don't use pepper water. They are not good. If you don't have any drugs around you at all, keep bathing your eyes with cold water. Within 2 weeks, that's maximum, you know, everything will settle. Now, epidemic keratoconjunctivitis virus, and there are many of them, they are not the only ones that affect the eyes. But it is important to know that very rarely this particular disease can affect the front part of your eye, known as the cornea. If it does and you find that you are not seeing clearly, please visit the nearest hospital. Visit the nearest hospital once you notice that you are not seeing well. Please don't forget, epidemic keratoconjunctivitis affects the 2 eyes. When only 1 eye is red, that is not Apollo. When only one of your eyes is red, it is not Apollo, it is something else. Now, what are the other viruses that can affect your eye? We have something known as herpes simplex virus. Herpes simplex virus infection is commoner in children, and usually the eyes water, but then the child, shuts one eye. The child does not feel comfortable with his or her eye. That one is a much more dangerous disease of the eye. It is better to visit your doctor then. Any child with red eyes should visit the doctor that is around, and I mean a doctor. That doctor does not have to be an ophthalmologist. Visit the nearest one so that they'll be able to tell you whether what that child has is something much more serious than Apollo, or like an ordinary herpes simplex conjunctivitis. There are other viruses that affect the eye, but we do not want to go into details with that. The lesson today is, when your eyes are red, do not apply your urine, do not apply sugar water, and do not apply salt water. And of course, never apply battery water to your eyes, because then we go blind, not from the disease itself, but from what you have applied.
Viewers, that's all we're going to take about Apollo, the popular Mr. Apollo. And we do hope that we've learned how to better take care of our eyes in case we contact Apollo. And more importantly, we want to advise that you also pay attention to the things that you have been told, particularly as to how to avoid getting infected when you have neighbors or family relations who already have Apollo, because it's a very, very highly contagious disease. But several things we can do to ensure that we don't transfer from one person to another very readily. I commonly joke with some of my clients. I say, "Oh, olojuko koronie," Well, this is where we're going to call it a day on this program, Sight Ed, and we do hope that you have enjoyed watching. You're welcome to Sight Ed, a sight educational program designed to enlighten every one of us about eye health issues. Our business is preserving vision and restoring sight. Today's episode, we're going to be looking at some systemic diseases that can affect the eye. And I must tell you, there are several of such systemic illnesses that have consequences on the eye. That is one of the reasons why actually we say the eye is the window to the body. Because by looking at the eye, we can get to know several diseases going on in the general body. So that is one opportunity you avail yourself when you go for regular eye checkup. So today we're going to be looking at some common systemic illnesses that can affect the eye. And to do justice to this, we have actually interviewed another expert, a consultant ophthalmologist, who will be talking to us about various systemic illnesses that can lead to blindness or that can affect the eye. We interviewed Dr. Chinyere Pedro, and she will be taking us through this segment. And of course, as usual, we also, at the end of this interview segment, we will continue watching the film on glaucoma, The Still Water. I want to believe that you're getting several lessons from this film. And also don't forget that you can always contact us on this program with your questions and comments through our social media outlet.
My name is Dr. Chinyere Pedro Egbe. I'm a consultant ophthalmologist at the University of Port Harcourt Teaching Hospital and an associate professor of ophthalmology at the University of Port Harcourt College of Health Sciences, River State. Okay, we have an eye model here, so I'll show you what the optic nerve is. So this is the eye. Now the optic nerve is this tub here. It's like a cord that connects the eye to the brain. So this is the optic. So what we're going to be talking about today are things that affect the optic nerve. When in neuro-ophthalmology we're talking about systemic diseases or even things that are occurring in the brain and then manifesting in the eye, and some directly in the optic nerve, some inside the surface of the eye. So when we're talking about systemic diseases that affect the optic nerve, we're talking about problems within the body that affect the nerve. And there are quite a few of them. We'll start with the common ones. Diseases such as high blood pressure, hypertension, that is if it's not well controlled, diabetes, high cholesterol level, sometimes also what we call sleep apnea. Some people, when they are sleeping, it affects their breathing. So in between they have, like shortness of breath, and they have to wake up. So these are some of the conditions. Also the kind of food, if we're not eating well, because the nerve, for it to function well, it has to be healthy. And some of the foods we eat provide that nutritional aspects for the health of the optic nerve. We're talking about food that have a lot of vitamin B's in them, like green leafy vegetables. There are also other systemic conditions. We've also found that women of childbearing age, not all of them, but some, are predisposed to having swelling of the optic nerve head, which if not well managed can ultimately lead to blindness. And this swelling of the optic nerve head, which we call papilledema, is actually commoner in young obese females. When we talk about young obese females, mainly those in the childbearing age, 15, 16, up to even 45 years of age. Like, there are so many of them, but I just want to mention a few that we can easily relate to. Sometimes you don't know, but one of the commonest symptoms is the patient presenting with poor vision. I was seeing before, I'm no longer seeing well. That's one of the commonest presenting symptoms. Or they tell you, colors, I'm looking at things, this red, it appears a bit washed out. It's not very deep. So, but sometimes you actually find it that somebody has an optic nerve problem on routine eye examination. Somebody comes in to have their eyes examined. They don't have any illness, and then when you examine, you look into the eyes, you will now discover that the optic nerve, there's some kind of disease. In the early stages, you may not know. It's only when it's later that your vision starts going down. My area of interest in ophthalmology is what we call neuro-ophthalmology. So we just mentioned optic nerve disease. There are other disorders in the body too that affect the eye generally. And this situation, somebody may say they have their upper eyelid is drooping, that is getting lower than normal, or they say they are seeing double vision, and it can be very troubling for a patient to see double vision, because if you're driving, then you cannot drive because you're seeing things too, and you can get into an accident. So those are some of the common symptoms the patients present with. So it's when you look further, you can now say, oh, this is due to optic nerve problem. This is due to some other problems in the brain. Then, when we talked about some of the systemic diseases, something like even the stroke, we talked about hypertension and the optic nerve. It causes problem with the optic nerve, like swelling of the optic nerve. If it's not well managed, the person can go blind. All these things I've mentioned, if it's not well managed, the person can lose vision, and that is why it is important to have your eyes examined at least once a year. If you have any of these diseases I've mentioned, diabetes, hypertension, you have to be properly managed by the physician. You understand? With the good control, then you won't have any of these problems. Even where they are there, you are able to control them, and then you won't lose your vision. But if they are not controlled or poorly controlled, eventually you will go blind. The first one is you manage your systemic problems. you manage, because some of these things, once they've happened and the process just progresses, and then you lose vision from it. So regular complete physical examination, where you know your blood pressure, your blood sugar, your cholesterol level. If you have any of these things, then they must be managed by the physician. That is one. For somebody who is obese, we talked about when there is a rise in the pressure in the head and the swelling. It's been found that if you lose about just 8% of your body weight, will cure it. So maintaining the normal body weight or something as close to normal also helps. Then when it comes to nutrition, eat well, eat healthy, not junk food. And when you're eating a lot of vegetables, green leafy vegetables, we have a lot of them around here. Food that contain vitamin B complex, the carrots, all those things, eat healthy, you will be fine. Your eyes will be protected. And then for your eyes, have regular eye examination. You don't go to the eye specialist only because you are not seeing. Because some of these things can be picked up early. And then with proper management, you'll be able to retain your vision. But where you don't do this, yours truly, you can say goodbye to your vision, which is the 20/20 vision. Or you just be functioning with poor vision, what we call visual impairment. Since we're talking about systemic illnesses, and we know that compliance with treatment is a huge problem, not only in developing countries, but also well-developed countries. We've also had experiences of patients taking their drugs just before they come to see the doctor. But here's the problem. It is difficult for the doctor to monitor every patient they see, because you can't go to their homes and tell them, take your drugs at this time. You don't know what they are doing. The best you can do is counseling. And in the counseling, you tell them about this disease, and you tell them about the importance of, proper control of either the blood pressure or the blood pressure or the blood sugar level. And that without this, that they can develop all the complications we talked about before, this swelling with resultant loss of vision if it's not properly managed. So I think the key here is counseling, and you can never counsel a patient enough. So you just keep doing it. Anytime you see the patient, you keep saying the same thing. You keep saying the same thing. And if you have the means, you can actually even remind patients, maybe even if it's once a week, about their drugs. Have you taken your drugs by text messages? That is, if you have the manpower. Presently, our manpower is we're kind of short of manpower, so we're just managing with the very few persons we have to work with. But this is the way to go if we're going to get any results. As patients, that we must take our drugs as at when due. Don't wait until you come to the doctor. Luckily for us, for something like diabetes, there are particular tests you can do that will tell you what your blood sugar control has been over the past 3 months. So if you come in and you just took your medicine the day before you came in or that morning, and we take your blood sugar and it's fine, and we did this and we do this special test, it will definitely tell us that you've not been very consistent or you've not been very compliant with treatment. So the key is take your medicines as at when due, and then you'll be fine. So my take home is that we should have regular, not just eye examination, but complete physical examination. And when we have systemic illnesses, they should be properly managed. Thank you.
Thank you very much, Dr. Chinyere Pedro, for that exciting and illuminating segment. We are very grateful. You're still on Sight Ed, a sight educational program designed specifically for you and for myself. And I remain your host, Adepo Jufei. All right, now we're going on to watch the short drama clip, still on the film Still Water. All right, we'll soon be drawing the curtain at this episode of Sight Ed, a sight educational program specifically designed for you. One or two quick things we hope you have learned from the film so far. One, the fact that glaucoma is a silent disease, it's painless, it's symptomless until the very end stage of the disease. Number two, that we expect that everyone that is 35 years and above will routinely go to check their eyes and be sure that they don't have glaucoma. And three, for today, is the fact that everyone who has glaucoma need to specifically invite their relations, children, brothers and sisters, to go and check their eyes because glaucoma can and do run in the family. Until next time again, I remain your host, Adepoju on Sight Ed. Thank you. Wow, we're really getting excited about this program, and by the volume of your correspondence, questions, and we sincerely hope that one of these days we're going to actually dedicate an edition to answer publicly to many of the questions that have been raised. But for today's program, I want to sincerely welcome you. I remain your host, Adepoju on Sight Ed. Again this week, we're going to talk about another very common ocular disorders. Although it's common, it tends to come in at a time and then you don't hear of it again. And after a period of time, you hear it again as if it's a visitor coming to visit and then to return. I'm talking about no other disorder but Apollo. Apollo is not the medical name, and we're going to tell you what exactly is the medical name and where the word Apollo came from. And then to do that, it's going to be another guest who we have interviewed on these also common ocular disorder.
I am Dr. Onobolu, and I'm from Olabisi Onabanjo University in Shagamu. I'm here to give you a brief talk on viral conjunctivitis. Now, viruses are very small living organisms that cannot live on their own, but they live on other living cells. These viruses can infect the eye. And what is interesting about it is that it's very rare to have a virus infect only one eye. Virus infections of the eye, they are usually very contagious, especially the one we know as epidemic keratoconjunctivitis. These viruses can spread very easily, especially in school children, in households, and in villages. As I said before, I said they are very, very contagious. So I just want to say that it is very rare to have one eye being infected with viral keratoconjunctivitis. So if you have only one eye that is red, that is certainly not epidemic keratoconjunctivitis. Can affect children, and adults of any age. But usually you need someone in the house or in a school or in the environment that would have had the disease before. So people usually present with watering of the eye and feeling as if there are stones inside the eye. We call this foreign body sensation in the eye. Within 24 hours, the eye will become red, the lids will become swollen, which we now say that the lids are puffy. Very soon, within another 24 hours, the other eye gets affected. So we have the two eyes being red, watery, and with this feeling of, foreign body sensation, as we say. Sometimes there's a discharge, but there's usually a purulent discharge only when the eye is infected by bacteria. It's very, very important when you have the two eyes being red, watery, and with this foreign body sensation, to be careful of what you use to clean your eyes. Because if you are not careful, then you will infect other members of your household or your friends, which simply means that if you use a hanky, then be careful that you don't throw that hanky away anyhow. or if you use a towel, make sure that your children or your mates do not use that same towel. Viral keratoconjunctivitis